Hello friends, in this video we will see about what is general anesthesia, what are all the components of general anesthesia and how a general anesthesia is carried out in a simple easy to understand English. So we can compare general anesthesia similar to that of a flight travel. When you board a flight, initially there is a takeoff, then the flight keeps on flying, so that is during that time the autopilot mode is turned on, then there is a landing. In the similar way, general anesthesia also has three components. One is induction, followed by maintenance, followed by reversal. Even before all these taking off and landing, you have certain preliminary steps by which you finish the checking, you board the luggages and you get ready for the flight travel. In the similar way, even before the exact general anesthesia happens, there is some amount of pre-medication which prepares you to the general anesthesia. So what are they usually? So one thing, whenever you are posted for a surgery, the previous day the anesthetist comes and sees you to do a checkup called as pre-anesthetic checkup. During this time, he prescribes you certain drugs. So the most commonly used drugs are, one is anti-anxiety drugs, because whenever any kind of person undergoing any kind of surgery, he will be anxious the previous day. Whatever it might be, like whether it is a young person or whether it is an old person, he might be definitely anxious. So if he is anxious, he might not sleep that night also. So to decrease, so that anxiety is not good for the surgery. As such, it will worsen the surgical outcome. So to decrease that anxiety, we give anti-anxiety drugs. Even for children, when they are taken from the outside of the OT, in the pre-op area, inside the OT, they are very anxious about losing their parents and all those things. So that time also we give anti-anxiety drugs to the children to calm them. So this is one drug. Second thing, we give antacids, which means drugs which reduce the gastric secretions, which reduce the acidity of the gastric juices. So why it is important? During general anesthesia, your ability to breathe is taken off. So a tube is secured inside your mouth like this. Some tube will go inside your mouth and it is connected to the ventilator, through which the ventilation will take place. During this process, there are chances that your gastric secretions may come inside your trachea, your windpipe, and it might affect your lungs as well. So that's why we try to decrease the gastric secretions and the gastric acidity, so that the chances of injury to the lungs already decreases. For the similar reason only, for the same reason only, we are asking the patient to be nil per oral, not to take anything before surgery, at least 8 hours for solid foods and at least 2 hours for clear liquids. So this is one thing. And the third thing, usually we give some drugs which reduce the secretions. Here we usually don't practice this. So these are some kind of pre-medications which prepare the patient even before the exact general anesthesia takes place. So right now we will see about what is general anesthesia. Once the patient comes inside the OT, he is made to lie on the table. First, initially all the monitors are attached to him, IV fluids are attached to him. Then the first most common drug which is given as the fentanyl. Fentanyl means it is a kind of opioid which gives pain relief. So anesthesia in general has a three components. One is analgesia, second one is amnesia, third one is muscle relaxation. So what is analgesia? Analgesia means pain relief. So why we need a pain relief? Because during a surgery, your abdomen is cut open, your muscles are cut open, your bones are broken. Despite all these process keeps on going, there is some amount of pain relief which you are getting through the drugs which we are giving. So that's why it is very important. It's not only about the memory which is being taken, because even if the memory is taken, you will be able to feel the pain. So that's why analgesia is very important during general anesthesia. So the second thing is amnesia. So one thing, you have got the pain relief, but still if you are able to remember all these incidences, like some tube is being put inside your mouth and someone is opening your abdomen, if you are able to remember all these instances post surgery, how much traumatic incident it will be. So definitely we need all these memories to be erased from our memory. So that's why amnesia forms an important component of the general anesthesia. And the third thing is the muscle relaxation. So in muscle relaxation, so during surgery we cut open the abdomen, we cut open the chest, we cut open the muscles, we cut open the bones. So if the muscles are not adequately relaxed, if they have some amount of tension, it will be really difficult for the surgeon to operate. So that time the surgical outcome will also be impaired. So that's why we give some drugs which relaxes only your skeletal muscles, not the cardiac and the smooth muscles. So only the skeletal muscles just get relaxed, so that the surgery can be done in a smooth way. So the diaphragm muscle, which helps in respiration, is also a skeletal muscle. So that's why during general anesthesia your ability to breathe will be taken off, and with the help of a ventilator your ability to breathe will be supported, your respiration will be supported with the help of a ventilator. So first, in general anesthesia, in the first component is induction. In induction we give the first drug as the fentanyl, which means which is a analgesia, which reduces the pain, because during intubation also we will have pain, and also it decreases the dose of the induction agent which is required. Now the second drug which we give, usually it is white in color. The most commonly used drug is propofol. Apart from that, we have few other drugs like etomidate, ketamine, midazolam, but still this is the most commonly used drug. The main function of this drug is the patient comes to the OT table awake and alert. So but he is made to sleep instantly with the help of this drug. So this is the function of this drug. And the third thing which we usually give is the muscle relaxation. As usually said, for the surgery to take place, we need good amount of muscle relaxation, and also for the endotracheal tube to pass inside your windpipe, muscle relaxation is so important. So after your muscle relaxation and memory and analgesia, all these components are taken off. Right now, a tube is usually commonly secured into your windpipe, and which is connected to the ventilator, and through which your respiration will be taken care of. So and one more device which is available is the supraglottic airway devices, which doesn't exactly blow inside your windpipe. It sits above your windpipe, but still we will be able to ventilate the patient. So once the induction is done, we have to maintain that phase. We have to maintain all the three components of anesthesia, like pain relief and muscle relaxation and loss of memory. All these three components should be maintained throughout the surgery, so that the surgery can be carried out in a better way. So for that, some agents which we usually call as vaporizers, which is connected to the circuit itself, when we open this will go inside the tube and it will reach the lungs of the patient. From the lungs it will be carried out through the entire body, and it will reach the brain, and it will help in loss of memory for the patient. So this is one component. And the second thing is for muscle relaxation, we will keep on repeating the doses of the muscle relaxation, so that throughout the surgery adequate muscle relaxation is maintained. And the third thing is for pain relief also, we give adequate drugs to maintain adequate analgesia for the patient. So during this phase it is maintained. So this is similar to the autopilot mode of the flight. So once the takeoff is done, the pilot is not doing anything, he is just sitting, he is just monitoring. In the similar way, once induction is done, we finish all our works, then we just monitor the patient's vitals for the surgeon to do their work, because if we keep on doing something, then the surgeons won't be able to do something, right? So during the surgery, the surgeons might go near a vessel, he might cut a blood vessel also. During that time, if he cuts a major vessel, within 1 minute 1 liter of blood might be lost. So that time you will find the falling BP, so you have to rush fluids, you have to rush blood. So getting all these things ready is also a part of the anesthesia, because that's how, it's not like once something happens you get things ready, because in surgery it is a very dynamic environment. You can't buy time, so we have to get ready. So whatever the monitor that is needed for BP, if you want to secure an invasive line, or if you want to give some drugs to pick up the BP, you need specific kind of lines, bigger lines. So all these things you do during the time of induction itself, after induction, before maintenance, so that you are prepared for the surgery to take place. So once the maintenance is going on, you will be able to, the surgeon will be performing the surgery. Once the surgery is done, you have to titrate all your drugs. The patient right now, he is not breathing, so he has to breathe at the end of the surgery, and right now the patient doesn't have any memory. At the end of the surgery, he should regain all his memory. And the third thing is, if patient has analgesia, this analgesia should be continued post-operatively also, but still it shouldn't be in such a high dose that he is so much sedated. So it should be in an adequate way. So that's how the reversal happens. In reversal, whatever the things that you have done, you give the memory back by controlling the agents, you stop these agents, you reverse the muscle relaxation. Whatever the muscle relaxation is there, we give some drugs so that the muscles start working in a normal way. So, and for analgesia, you give adequate drugs so that the patient doesn't feel pain at the end of the surgery. So these are the three main components of the general anesthesia. You would have noticed during flight travel, sometimes the takeoff and the landing will be in a much harsher way, and sometimes the takeoff and landing will be in a much smoother way. However, whether it is harsh or whether it is smooth, still you are able to reach your destination, right? In the similar way, whether the anesthesia is good or not, still the surgery is going to happen. But carrying the anesthesia in such a good way is the role of an anesthetist. So anesthesia surgery shouldn't be a harmful experience for any of the patients undergoing surgery. It should be in such a way he is like coming to a tourist spot where he is just relaxing, having a good sleep, and he is just waking up. None of the patients should wake up in pain, none of the patients should wake up in some confusion. Anesthesia should be in such a way that he is like completely relaxed and he is waking up fully awake, not in a confused state. So that's how the role of the anesthetist is. So this is one thing, and as I have already said, it's not only about giving anesthesia and taking this memory, it's about maintaining the entire component. During anesthesia, there is like so much amount of dynamic environment which is going on during the surgery, like right from the blood loss, right from the ventilation, right from the evaporative loss, right from the temperature. So everything you take in control, you monitor all these things, so that at the end of surgery, whatever the patient came inside the OT, you try to send the patient back with the same physiological state. So I hope I have explained anesthesia in as simple way as possible. If you have any doubts, please leave in the comments. Also, if you have any suggestions regarding the future topics related to anesthesia, please leave them in comment, so that I will try to make those videos in the upcoming make those topics in the upcoming videos. So I hope this video is useful for you. I will see you in one another video. Until that, it's Aravind signing off. Bye.